Today we are going to talk about incidence and prevalence rate. I have found a very simplistic diagram to explain this, but let's understand what incidence means and what prevalence means, right? Incidence means new case, and prevalence means old case plus new case. A very simple way to understand this is incidence is the new drop of water coming out from the tap, right? The new water that is coming out of the tap. This is incidence. And the water which is already present in the bucket or whatever the container is, along with the new water, the old water is also present. So this is prevalence, right? So incidence is the new water coming inside the bucket, and prevalence is the new water plus the old water. So that's prevalence. Now, the drainage I am drawing down here. What is this drainage? Now, this drainage is death or cure, right? Death or cure. What happens if there is increased amount of drainage? If there is more death or if there is more cure, then the water is going to decrease, right? So if there is more cure or more death, then the prevalence is going to decrease. If there is less death, if there is less cure or less death, then the prevalence is going to increase. Now, let's create a formula for this water calculation. Let's suppose as the time progresses, the amount of water present in this container increases, right? So duration. This is the prevalence. Prevalence equals to incidence is increasing, right? The more amount of water comes inside and the more duration it takes, right? So prevalence means duration into incidence. The longer the duration, more will be the prevalence. Like longer the duration, more will be the prevalence. More the incidence, more will be the prevalence. Prevalence is defined as incidence into duration. This is our basic formula, right? Now let's look at few questions. Prevalence is low, but incidence is high. What does that mean? Let's just have a look at this picture. Prevalence is low, but the incidence is high. The prevalence is low, but the incidence is high. There is very high incidence. Despite having high incidence, why is the prevalence low? The prevalence is low because the drainage is very huge, right? If the drainage is really big, if the drainage is very big, then prevalence is going to be low, right? So all of the water is being drained outside from this pipe. So incidence is more, but still if the prevalence is very less, then that means there is increased number of death or there is high cure of a disease, right? So prevalence is low, incidence is high. What does that mean? That means there is increased number of death, that means highly fatal disease, or there is increased number of cure, that means easily curable disease, right? I think you understand this. Now let's look at another question. Incidence for a disease is higher among females, but prevalence is same in both sexes, right? So incidence is high in females. This is female, this is male, right? This is male tap, that is female tap. Incidence is high in females, but incidence is very low in male, but the prevalence is same in this level, in this level. How can this happen? Incidence is high but prevalence is same. How can that happen? It can happen if the output in male is very narrow, output is very low, and the output in female is very high, isn't it? If the outflow is very high in females, excess amount of water is flowing outside and very less amount of water is flowing from the male side, then this can cause equal number of prevalence. That means death may be high in female or cure may be high in female of that disease. If the incidence is higher among female but prevalence is same, then that means the mortality of the disease is very high among females, or the cure of disease is very high among females. Do you understand that? In contrast with the male. So this is the next question. Now let's have a look at third question. If a better vaccine or drug is introduced, what will happen to the incidence? This is the normal cure rate. Okay, this is the normal cure rate, right? A better vaccine is introduced. What does that mean? Better vaccine is introduced means the pipeline system is upgraded. This was a narrow pipe before. Now, if the pipeline system is upgraded, the pipeline is going to be very big, right? Better vaccine. Better vaccine means easily cured or easily prevented. So what is going to happen? The water is going to be drained outside more. Incidence is here, but prevalence will be low, right? Prevalence will be reduced. If there is better vaccine or drug, then prevalence will be decreased because maximum drainage is occurring from the improved drainage pipe, right? If a drug reduces mortality due to disease but does not cure, then what does that mean? Mortality is being reduced. Means suppose this was the pipe, right? The drainage pipe. Mortality is being reduced means what? It means that the pipe is being narrow, right? The pipe is being narrow. Death is being reduced means the pipe is being narrow. So what is going to happen? The water is going to be accumulated more. There is less amount of water going to flow outside. Previously, more amount of water would flow. Now, less amount of water will flow outside. So because of this, what is going to happen? Because of this, prevalence is going to increase, right? If there is less amount of water draining outside, prevalence is going to increase. I hope you understand. Thank you very much.